So there is a mom out there, she has just given birth, but this mom is feeling some pain, she's feeling some itchiness in the rectal area, she's seeing some blood in the rectal area. These are signs of what we call postpartum hemorrhoids. Now, postpartum hemorrhoids are not something to be ashamed of. Most mothers, if not some, get them after birth, and these things can recover with proper management and proper knowledge about them. So what are postpartum hemorrhoids? These are simply swollen veins in the rectum that come as a result of the whole birth process. Now, there are many causes of postpartum hemorrhoids, but one of the greatest causes is the pregnancy itself. Let me explain. Now, as the fetus develops, it causes a bit of compression on the inferior vena cava. What this does, it makes blood to pool back in the extremities, inclusive the rectum and the legs. Now on the legs it will cause varicose veins, but also in the rectum it will cause those swollen veins. However, you should know that hemorrhoids are varicose veins of the rectum. So that is the number one cause of these postpartum hemorrhoids. Number two, the hormone progesterone is one of the main hormones that helps to maintain the whole pregnancy. Now, what progesterone does, it helps, or rather, it makes the blood vessels to relax. Now, remember, during pregnancy, you already have a higher blood volume. Now, again, you're having these, the fetus compressing your inferior vena cava, blood is already pooling, and then also this progesterone is coming in to reduce, to make the veins relax, and then also add more to this effect of blood backflowing. So that will in turn also contribute to the formation of the postpartum hemorrhoids. What else does progesterone do? Progesterone slows down gastric motility. This is simply the movement of food, the movement of stool that has been formed in your large intestines. Now, when this gastric motility is slowed down, what happens is the body keeps absorbing more water from the stool, and the result of this is the stool becoming hard, and you get constipation. Some of this can be evidenced by your pre-menstrual period, where you have a high surge of progesterone, and most ladies will experience a bit of constipation. So the same thing happens during pregnancy. Now, constipation itself can also boost you having the hemorrhoids as well, because you're going to be straining, you're going to be trying to push this stool out, and you're going to cause those veins those blood vessels in the rectum to ouch, causing you hemorrhoids. So what are some of the risk factors? Now, when you go to Google, obviously constipation, pregnancy will be at the top. But what are the risk factors in the pregnancy course that can cause you to have hemorrhoids after childbirth? One of them would be having prolonged labor. When you're in prolonged labor, you will definitely get those hemorrhoids. As this baby is compressing the rectum, you'll definitely get those hemorrhoids. When you have a big baby, you will get those hemorrhoids. The third one would be you having a longer gestation period beyond 40 weeks, which is usually in bigger babies. Still, that will result in you getting hemorrhoids. When you have a natural or a spontaneous vaginal delivery, in some cases, you may be predisposed to getting a hemorrhoid, because as the baby comes out, it still compresses the rectum and its vessels and can cause hemorrhoids. So those are some of the risk factors that can cause you hemorrhoids. And maybe a lesser or a risk factor that's not so common could be when you have pregnancy complications which result in you getting a C-section. This can lead to you having a sedentary lifestyle. Now, a sedentary lifestyle in itself can lead you to have hemorrhoids, because as you're having this sedentary lifestyle, you're trying to rest and leave your scar to heal. So that in itself can predispose you to having postpartum hemorrhoids. Now, what are some of the things that we can do to prevent or to manage these hemorrhoids. Number one, you can try to increase your water intake as much as possible. Water is extremely important. If you're not taking enough water, that in itself will predispose you to constipation and lead you to having hemorrhoids. Number two, taking enough fiber. As much fiber as possible. You can get fiber from cereals, you can get fiber from good porridges, all those have fiber, fruits, vegetables, all these things have fiber, and they also have minerals like magnesium, which are useful in making your stool softer and easier to pass out. Number three, do some exercise. Do some exercise, keep active, as a sedentary lifestyle can predispose you to getting hemorrhoids. Lastly, when you get symptoms like pain as you're passing out stool, a bit of blood when you're cleaning, or even blood in the stool, when you feel the hemorrhoid itself as you're cleaning, because hemorrhoids are of two types. There is the internal, there is the external. The external ones are the ones you're most likely to feel. When you feel there is a bit of a lump there, kindly report that to your medical doctor, report that to your gynecologist to have it checked out. There are two ways which this can be checked out. You can either do a physical observation, or based on your symptoms, you can do a digital rectal exam where you physically insert fingers and find out what exactly is going on there. You can also do an endoscopy to find out and differentiate whether it's an anophasia, because it can cause similar symptoms, only difference is that it's more painful, or it's an internal hemorrhoid. So with that information, I have tried to break down what causes hemorrhoids, some of the symptoms you should look out for, how we diagnose hemorrhoids, and how we can manage hemorrhoids at home. One last tip could be using a sitz bath, where you put a little bit of salt and make saline water at home and sit in it. It can help to reduce this inflammation from the hemorrhoids. So with that, I think you are now well equipped and know what causes hemorrhoids, what they are, how we diagnose them, and how you can manage them from home, in addition to the medical management that your doctor or your gynecologist will have given you. So if you liked this information and would like to know more basing on your postpartum recovery, to know more how to handle your postpartum period, kindly like, share, subscribe, and click that notification bell to stay in the know of whatever is happening and whatever new video we upload.